sir, I am Jumana Kim S. Alvis, your student nurse from Camarines Sur Polytechnic Colleges. So for today, I am going to demonstrate the assessment of mouth, nose, throat, and sinuses. So the purpose of this is to prevent from infection and also to prevent illness and also to remove dirt from the body and environment and also to promote good health and also to maintain a quality life of an individual. So without further ado, let's get started. Good day, ma'am. I am Jamela Kim S. Alvis, your student nurse for today. So, ma'am, can you please state your complete name po?
I'm Josephine is Alvis.
Okay. Then, how about your birth date, ma'am?
June 9, 1981.
Okay. Then, how about your age, ma'am?
40.
Okay. So, for today, ma'am, I will be assessing your mouth, nose, throat, and sinuses. So, in order for me to do that, ma'am, I will be needed your full cooperations later on the procedure. So, is that okay with you, ma'am?
Yes.
Okay. Ma'am, may nararamdaman po ba kayong mouth problems po?
Wala po.
Sinuses problem po, like pain over sinuses po. Ano naman?
Wala.
Post-nasal drip, ma'am.
Wala po.
How about, ma'am, nose problems, gaya po ng nosebleeds, stuffy nose, or
Wala.
cannot breathe po through one or both nostrils, like change in ability to taste or smell po?
Wala.
Ano naman? Okay, ma'am. So, ma'am, proceed na po tayo sa past history niyo po. So, ma'am, do you have a previous treatment po about mouth, nose, throat, and sinuses?
Wala po.
Wala naman. So, ma'am, gumagamit po ba kayo ng nasal sprays?
Wala.
Wala naman. So, do you have a history of tooth grinding po? Tooth grinding po sa
Wala po.
Wala naman. So, ma'am, kailan po yung last dental visit niyo po?
Mga February.
February. So, sa family history niyo naman po, ma'am, sa family niyo po ba, ma'am, meron po bang may oral, nasal, or sinus cancer, or chronic problems po?
Wala.
Wala naman. Okay po, ma'am, proceed na po tayo sa lifestyle and health practices niyo po. So, ma'am, sa daily activities niyo po ba, meron po ba kayong oral care, or the tooth care, or denture care po? Meron. So, ma'am, nagda-diet po ba kayo?
Minsan lang.
Minsan. So, ma'am, do you have history of smoking po? Nagsisigarilyo po ba kayo, ma'am?
Hindi.
Hindi. So, ma'am, nagiinom po ba kayo?
Occasionally.
Okay. Then, we can now proceed to the procedure. So, I already gathered and prepared the equipment or the materials that I am going to use. Then, before I came here, I already provide the client's privacy to make the patient comfort and safe. So, before the procedure, we need to perform the hand hygiene to prevent the transmission of microorganisms from one patient to another. So, I am going to sanitize my hands. Next, I am going to wear the gloves. So, ma'am, I am going to examine your mouth if you have a mouth problem. So, ma'am, can you please open your mouth? Okay, so wala naman po kayo, ma'am, distinct odor. Then, next, I am going to use the pen light and also the tongue depressor to retract the vocal mucosa, the gum, and then the tongue to check the color variations like redness, and also the white patches, and also the pillars. So, then check for the moisture, tissue, consistency, the lesions. So, ma'am, can you please open your mouth po? Then next, inspect for the gums hyperglycia and blue lock color. Then next, inspect for the tooth number, shape, and also the color occlusion. Open your mouth, ma'am. Then next, inspect and palpate the tongue for color, texture, consistency, and also the moistures and also the size. The other side. Ma'am, taas niyo po yung dila niyo po. Baba po, ma'am. Okay. Move niyo po yung tongue niyo po side. Side. And then the other side po, ma'am. Okay. Then next is palpate the tongue using the sterile gauze to hold the tongue. So this is the sterile gauze. Okay. So, ma'am, labas niyo po yung dila niya. Okay. So there are no lesions ulcer and also noodles are apparent. Next, I am going to do is I am going to inspect the soft and hard palate for the color, shape, and texture. Okay, so the soft palette are light pink and it is smooth, and then the hard palette has a more irregular texture. We can now proceed to the throat. So next I am going to inspect the throat for the color, consistency, and then the thorax, palate, stain, and also the uvula. Okay, so the throat are normally pink without exudate and lesions. And ask the client to say to watch the uvula and soft palate to move. Say up. Okay. Then next, inspect the tonsils for the color and consistency with the grading scale of grade 1, grade 2, grade 3, and grade 4. So the grade 1 which the tonsils behind the pillar, and the grade 2 is in between the pillar and uvula, and then the grade 3 is in the touching the uvula, and the grade 4 is in the midline. So now, ma'am, I'm going to inspect your tonsils. Then next we can now proceed to the nose. So inspect and palpate the external nose for the color, shape, consistency, tenderness, and patency of airflow. Then next inspect for the internal nose for the color, swelling, exudate, and also the bleeding and perforated septum or polyps. And next, we can now proceed to the sinuses. So, we need to palpate the sinuses for the tenderness. Mhm. Then next, percuss and transilluminate the sinuses for the air versus fluid or puffs. For the analysis of data, formulate nursing diagnosis, and also formulate collaborative problems and make necessary referrals. So that concludes my demonstration in assessing the mouth, nose, throat, and sinuses.